Welcome to the Cow's Milk Protein Allergy, the Next Steps presentation. This presentation has been devised to help you reintroduce cow's milk protein into your child's diet. Outline of the session: what is cow's milk protein allergy, symptoms and diagnosis, introduction of other common allergenic foods, cow's milk-free alternative products, reintroducing cow's milk back into the diet, meeting calcium and iodine requirements, and finally, vitamins for children. What is cow's milk protein allergy? It's an abnormal immune response to the proteins found in milk, whereby the body interprets the proteins as harmful. It is one of the most common food allergies in children, affecting around 2 to 7.5% of children. There are two types of CMPA. One is immediate reactions, also called IgE mediated. Symptoms typically show within minutes of having milk. There is also a delayed reaction, and we call this non-IgE mediated. Symptoms typically show within hours, sometimes days after having milk. Lots of people ask, will my child ever grow out of their allergy? And for most people the answer is yes. Some children with mild to moderate non-IgE mediated CMPA will grow out of it by their first birthday. 75% of children will have grown out of it by the time they get to 3 and 90% by 6 years of age. Some, however, may take longer than this or may not grow out of it at all. Symptoms of cow's milk protein allergy. Often we see unsettledness or persistent crying, diarrhea, constipation, stomachache, nausea, reflux or vomiting, blood or mucus in the stools, and sometimes wind. We can also see skin symptoms such as eczema, hives, rash, spots around the mouth or on the face, and sometimes children can be runny or have a congested nose. These symptoms are typical of somebody with a non-IgE allergy. Symptoms for IgE allergies include swelling of the face, eyes or lips, puffiness of the eyes or cheeks, and rarely swallowing or breathing difficulties. The diagnosis of CMPA depends on the type of allergy. For the immediate reactions, there are blood tests, also known as a RAS test or a skin prick test. However, for the delayed reactions, the test is to exclude the food and then reintroduce it. For those of you that are not breastfeeding, you'll be familiar with one of these types of formulas. On one side, we've got extensively hydrolyzed formulas, including Aptamil Pepti-1, SMA Althera, and Nutramigen. And on the other side, we've got the amino acid formulas, Neocate, Pure Amino, and Alpha Amino. Depending on your child's severity of allergy, will depend on which formula they are settled on. The extensively hydrolyzed formulas are broken down into the peptide chains, making them easier to digest, and the amino acids are broken down into the amino acid components, making them easier to digest still. Suitable alternative milks. These can be used in cooking over 6 months of age and as a main drink from 12 months old. We ask that you choose a milk with added calcium and iodine for your child's bone and brain development. Soya milk is closest to cow's milk in terms of energy and protein content. However, some children with CMPA can also cross-react to soya, and so in this case we would recommend an oat or a coconut milk to your child's taste preference. From 2 years and over, children can be transitioned onto the below varieties, such as almond milk, hazelnut milk or hemp milk. These have a lower energy and protein content, which is why they are recommended for slightly older children. Rice milk, however, should be avoided in under 4.5-year-olds due to the traces of arsenic. These are some of the dairy-free products that you might have found when you've been shopping now that your child is weaning. You might see some brands that you recognise and some that you do not. Again, we would ask you to look for fortified versions of these products, so products that have had the calcium and the iodine added back into them. Please note, organic varieties will not have these nutrients added back in. Following on from that, here are the calcium requirements for children of different ages. So we can see that at 0 to 12 months, children require 525 milligrams of calcium. It's not only needed for helping to build bones and keeping our teeth strong and healthy, but also regulating muscle contractions, including the heartbeat, and making sure blood clots normally. A lack of calcium could lead to a condition called rickets in children and osteomalacia or osteoporosis in later life. Another important nutrient to consider when following a dairy-free diet is iodine. Children of this age require 90 micrograms of iodine, which is important for brain development as mentioned before, but also for the body to make hormones, utilise energy and manage our temperature. Sources of iodine that aren't dairy include eggs, sea fish and shellfish, so it can be a little tricky to obtain if your child has multiple allergies. The introduction of other allergens can sometimes be a great source of worry for some parents, especially when there's already an allergy present. However, there is lots of evidence to support not delaying allergen introduction, as this can lead to a reaction later down the line. The guidance suggests the introduction of well-cooked egg first, then peanuts and other allergens to follow. We would recommend starting off with a very small amount, such as 1/4 teaspoon. We would not recommend rubbing the allergen on your child's skin, as this can lead to food sensitivity when ingested. This is the milk ladder, and it is a 6-step process for reintroducing cow's milk protein back into the diet. We generally recommend doing this between 10 to 12 months of age or 6 months after they started a cow's milk-free diet, which includes the formula. Please ensure your child is well before commencing, as this will make it easier to spot any reaction. We often recommend starting with 1/4 portion and building your way up to a full one over the course of a week. However, you can take longer to do this if you wish. We would generally advise starting with 1/4 malted milk biscuit and monitoring for 2 days after it is given. If your child shows no reaction, you can go ahead and offer half a biscuit. Again, monitoring for 2 days for any reaction. If your child remains fine, you can give them a full biscuit and again monitor for 2 days. After this, you can move up to step 2 and repeat the process. However, a small plain fairy cake will be fine at this stage. Please ensure it does not contain icing or chocolate, as this adds to the milk content. You can buy store-bought options, or we do have some recipes. If you would like them, please do give us a ring and we can send them over. If your child reacts at any stage, we would advise to stop for a minimum of 4 weeks on that step, but keep in any things that they've tolerated previously. For example, if your child reacts at cheese, we would say to stop for 4 weeks, but keep in the biscuits, cakes and pancakes to keep their tolerance level where it is. Finally, vitamins for children. The government recommends all children aged 6 months to 5 years are given a vitamin supplement containing vitamins A, C and D. Babies who are breastfed should be given a daily vitamin D supplement from birth. For babies that are formula fed, they do not require multivitamin supplementation until they are taking less than 500 ml of formula, which equates to about 17 ounces. On this slide are some useful links for further support and also some recipes from the cow's milk free brands. If you do require anything further, please do not hesitate to contact us, and thank you for listening this far.